What happens at a care conference in long-term care when there are behaviors of concern? We hope the information in this video will be helpful in preparing you for a care conference. In the making of this video, we partnered with family and care partners, residents, and staff from 2 long-term care homes in Ontario. What is a care conference at a long-term care home? A care conference is a meeting that brings together the resident, their family or care partner, the nurses, and other healthcare staff to talk about the needs of the resident. A care conference is organized so that everyone in the care team can work together to understand changes in behaviors of concern and develop a care plan that reflects the resident's unique needs, values, and beliefs. As the family or care partner, you are essential to the care team because you know the resident and their life story. The care team may refer to using the PIECES approach. Healthcare teams use PIECES to guide assessment and develop care plans. Using this approach to work together and have conversation supports the development of a shared understanding of what is happening at this time, what might be contributing to behaviors of concern, and a plan for moving forward. This approach focuses on what matters in the person's life and always considers the person's physical, intellectual, and emotional health, strategies to support their capabilities, their social and physical environment, and social self. Who attends the care conference? You, the family or care partner of the resident, and other family members or friends may attend. Consider having more than one family member to provide input and support. Healthcare staff involved in the resident's care may attend, which may include a physician, nurse, personal support worker, social worker, recreation therapist, physiotherapist, or occupational therapist. What can you do to get ready for a care conference? First, understand why a care conference was called. Ask questions so you know what will be discussed. Also confirm the date, time, location, or virtual platform of the conference and who to contact for questions or concerns. You can ask about staff who will be attending and their contact information, and you can ask for the meeting agenda in advance as well. Spend some time to think about your family member or friend's health and any changes you noticed in behaviors of concern. You may also want to consider any relevant life changes that may have occurred recently. You may want to write down your thoughts and develop a list of questions you have to bring to the care conference. A care conference can be held in person at the long-term care home or virtually. A virtual care conference can be done using an online communication tool such as Zoom or Microsoft Teams from a computer, iPad, or smartphone. You will need to know whether the virtual care conference will be using Zoom or Microsoft Teams. You will need to download and install the tool onto your computer, iPad, or smartphone. You will be emailed a link to connect to the virtual care conference, while other participants at the long-term care home might gather in person and be visible to you together as a group from a large screen TV. It will be important to set up your computer, iPad, or smartphone in advance. A good idea is to practice using the virtual video communication with a friend or relative who can offer support. You may wish to set yourself up in a private and quiet setting. Log into the care conference at least 10 minutes early. Have a pen and note-taking paper ready so you don't feel rushed at the start of the conference. It may be helpful to take notes during the conference as well. What happens during a care conference? Staff will share information and observations about behaviors of concern. You will be encouraged to share your own observations, opinion, and ideas about how the behaviors might relate to their health and life experience. The purpose of the care conference is to have a shared understanding about the behaviors of concern and find solutions together. By the end of the CARE conference, there will be a plan for moving forward with care strategies to support the resident and address the reasons for the behaviors of concern. You can also request a written summary of the meeting, including the follow-up plan, next steps, and timelines. Staff will follow up with you within a few weeks with updates. There may be a need to meet again to discuss how the care plan is working and to make changes. This is normal and helps to develop a plan that supports the care the resident needs. Additionally, you may reach out to the team to find out how a care conference can be requested. The long-term care home will have a process for scheduling care conferences. We hope this video helped you to prepare for a care conference. This video was made as part of a Healthcare Excellence Canada-funded research project called Co-Design of a Toolkit for Long-Term Care Homes, Implementing Virtual Team Care Planning Using Pieces, led by Dr. Denise Conley from Western University in London, Ontario, Canada. This video was made in collaboration with Pieces Canada, Copper Terrace, Vision 74, the Registered Practical Nurses Association of Ontario, the Idea Lab at the University of British Columbia, and McMaster University. An infographic has been created as a brief summary of the information presented in this video, as a resource to share with long-term care staff and family and care partners. It may serve as a brief reference of the steps to prepare for a care conference. You can also find instructions to downloading Zoom and Microsoft Teams, as well as a valuable Pieces resource in the description box down below.